Hello, my name is Craig Mawdsley, physical therapist with Flexeon Rehabilitation in Chicago, here to bring you another marathon training quick tip in time for marathon training season. Flexion is excited to be supporting the Chicago area affiliate of Susan G. Komen Marathon for the Cure. This fall, our staff will assist the Komen Marathon for the Cure team at the Bank of America Chicago Marathon. A common injury that affects runners is Patello Femoral Syndrome. Patello Femoral Syndrome is a pain or maltracking of the kneecap, or the patella. This can occur for several reasons, including restriction or pain along the iliotibial band on the outside of the knee, or an imbalance of muscle strength from the quadriceps, the muscles in front, or the hamstrings muscles in back. One treatment that is commonly used in the clinic and outside is dynamic strengthening of the lateral muscles of the hip, the gluteals, and the muscles of the front of the knee, the quadriceps. We're demonstrating this in two ways. The first is by performing a mini squat. In performing a mini squat, we're taking care to align the hip, the knee, and the foot as to avoid putting overpressures to the lateral aspect of the knee. This can be progressed by changing the surface in which the individual is standing on. In this case, we're using a Bosu to provide more of a challenge for the individual. The second way in which we're demonstrating this is by performing a lateral hip hike. A lateral hip hike is performed by standing on a box. By raising the hip, the gluteals on the stance leg are activated. The Flexeon quick tip to try and prevent Patello Femoral Syndrome from occurring includes the following. First and foremost, don't avoid cross-training. Running alone will not adequately prepare you for longer distance events. More specifically, a targeted functional strengthening program of the hip and the knee will also prevent this condition from occurring.